Good day, everyone. Welcome to another episode of Collaborative Connections, a space for sharing and learning, sponsored by the Society for Oncology Massage and the Society for Oncology Aesthetics. My name is Erica Clinton, and I will be your host for this episode. On today's podcast, we have Daniela Panzeri, regional champion from Italy. Daniela has been a massage therapist for the last 8 years. And since 2019, most of her work is focused in oncology and palliative care. And we wanted to spotlight her today because she's doing a lot of amazing things in the field of oncology massage, particularly in her home country of Italy. And we wanted to have her share with us some of those really exciting things that are happening for her. So thank you, Daniela, for taking the time to join us today. I really appreciate it.
Thank you, Erica, too. It's a pleasure to be here with you today.
Wonderful. First, let's just have our listeners get to know you a little bit more. Can you tell us a little bit about your work in Italy? I think besides oncology, you work also in palliative care as well with your practice. So what is your work like?
Okay, thank you. I'm basically focused on palliative care since 2022, when I came to Italy after being living in the Netherlands for 8 years. And I discovered palliative care when I came here, working with people hospitalized in palliative units in hospice. And I discovered also at the end of life, not only people affected by cancer, but also people affected by dementia and neurological disease like sclerosis multiple or amyotrophical lateral sclerosis, the ALS, and also people that are suffering from chronic pain that were hospitalized for a couple of weeks to find a new treatment of medicine that can be useful to allow them to stay home, not suffering a lot from these diseases. And palliative care is also an important unit in Italy because sometimes people make an association from palliative care to the end of life, but it's not the same. What I discovered is that people were treated in the hospice looking at the quality of life. You know that Dame Cicely Saunders was one of the founder of palliative care in England. And then she said that people in hospice need to be treated not to give them day of life, but to give them life to the days that, and that's what we basically focus on our unit. Currently, I work for 3 hospice, and we are in the region Emilia-Romagna, in the province of Forlì-Cesena. What is my experience is that people suffering from cancer or not have the same effect of oncology massage and palliative touch. There is a so simple touch, a so gentle touch that makes them completely different after sections of 5 or 10 minutes of massage, because sometimes it's not expected. So they say, okay, it's that interrupt our daily routine in hospice. So you are welcome to do that, but also a sort of expectation that we can bring something new, something that can relax, but also ease pain. And what happened always is that they smile or they sleep for 1 hour, 2 hours, or 3 hours, depends on people. And yes, I'm very happy to do this work because it seems not a job, but it seems a mission. Because sometimes I feel that after one touch or after 2 or 3 caresses, people fall asleep.
Yes.
And the simple touch that we do and then makes people so feeling good.
Yes, it's amazing. And I think that's very common amongst all of us who do this work, that it doesn't feel like a job. It really
Yeah.
feels like something more important than that, like a mission and a true calling for many of us who work in these settings. Is it in the palliative care and hospice units where you work, is it common to have a massage therapist?
No, I'm the only one. And
Well,
that's amazing. And then I am the only one. And then in two hospice, I came for 2 days per week. And in one hospice, I came only for 1 day. But sometimes I feel a part of him because people sometimes think that I'm not recognized as an healthcare professional. There is always an interaction within the team with nurse, with doctors, with the physiotherapist, the psychologist, and we help each other to give people an amazing experience in hospice. The last year that we have a session of music therapy and massage together, and it was amazing amazing experience too, because people doesn't expect it that they are in hospice and then they feel like in a spa.
that's wonderful. I think it's always really exciting when the different types of therapies can come together and work in the same space. And I really have seen that music therapy can enhance the massage experience so much more. So that's wonderful. Did you seek out this work, or did the hospices find you? Right? You were the only person working there. I'm like, were you the go-getter who just was like, you need me and I can
Um,
show you what I can do? Or did you get a reputation that people were like, you need to work at this place and we'll figure that out?
when I got my certificate in the Netherlands, I always think that I had to bring the professional as an oncology massage therapist in Italy. So I was busy for 2 years searching something in Italy. And then I came in contact with with IAR, the Istituto Oncologico Romagnolo. It is a sort of oncological institute that provide research and provide service for oncology patients here in Romagna. And with them, I knew the doctors in the hospice, and they asked me to work with them. So basically, I was not called to do this work in Italy, but I think that the reputation that I have as a part of the Society for Oncology Massage gave me a sort of official recognition of my profession. And I started working for two associations, basically two of the third sector association in Italy. And I feel very happy to do this job with them because they give me the opportunity to expand also the network.
That's wonderful. That's amazing.
Yeah.
So how did you hear about S4LM?
Yeah, I heard about this when I was doing the course in the Netherlands. The director of Ecological Institute of Cancer, Estelle Smits, who is also one of most important members in Europe, told us. She was talking about the S program as an official provider of education research in our field, and I was attracted by the S program. And then I say, okay, maybe it's becoming a member of the society that I can reach more people and expand the activity in my country.
That's wonderful. And so has that happened? Has being a preferred practitioner kind of helped you extend your reach
Yeah,
in Italy?
yeah,
Wow.
exactly. Now, as a preferred practitioner and Italy regional champion, I'm in contact with a different kind of association, basically esthetician. It's the same path that you are stepping to the collaboration
Yes.
with esthetician in America. And then we are looking for a collaboration together. It's something difficult, but I cross my fingers that we can reach something together.
Yes, that'll be wonderful. When we embarked on embracing oncology aesthetics, we really had no idea the extent of the work that oncology estheticians do. And when we researched it, it was kind of amazing of all the support that they provide oncology patients. And so the kind of the coming together of the two professions just made sense, right?
Yes,
We
exactly.
support the idea of, treating the whole person, and everybody has an area of expertise that really can benefit someone who's going through cancer treatment. So I will keep my fingers crossed as well for you to be
Yeah.
able to bridge that gap. And I think it'll be wonderful as well, just in terms of getting people to understand what you actually do and how much the work supports people. So you're our regional champion in Italy, our sole regional champion in Italy, which is amazing and exciting. And hopefully there will be more regional champions in the country as things expand. But what's it like being a regional champion for you?
I think that the regional champion gave me the opportunity to be always engaged for education, because
Mm.
sometimes you feel alone, even if you don't have people that can provide you the actual news or actual education about oncology massage and about oncology in general, and to discover more people and then talk with them if you have any problem. It is a sort of network also based on the experience that we have. And it's very nice to hear the podcast, to hear about how the news are in oncology massage in America, because here in Europe, we look always American doing the research and activities because we are following the same path.
Yes. So I heard that you're writing a book.
Yeah. Yes.
That's amazing. Can you tell us a little bit about your book? Like, what is it about? Who's the book for, essentially?
Yeah, I wrote a book last year. I starting on reading a book of Emanuele Exitu that brought in Italy a book about James Cicely Saunders. And then I took the inspiration to give patients a voice to share their story, even if they were being massaged by me. The stories sometimes were difficult to be told, but the story sometimes came is in a flow. So I was thinking about the people, and then the story comes flow from my mind very quickly. And I did it basically to let people know about oncology massage. And I did it about for people the treatments of oncology treatment, and or people that are interested in oncology, basically also healthcare professionals, but also massage therapists and estheticians. I think that it's a good point to reach people, because sometimes we are continually looking to the statistic, to numbers, and that the stories reveal more than numbers. And I hope that
Yeah.
the book will be published by this year. We don't know yet.
Okay.
But yeah, I hope so. And
Congratulations.
cross fingers for that. Yeah.
Congratulations. That's
Thank
amazing. That's amazing. And that's such a wonderful thing to, put people's stories on paper, right? Because then they're kind of timeless. They live a lot longer than the person may, and they give the rest of us who read those an opportunity to bear witness to that person's experience. And I think, to give people a voice who maybe aren't listened to so much is a really amazing thing. So that's very, very exciting. And I really, really hope that it gets published this year, and then, maybe even gets published in English so that some of us across the pond can read it. But that's wonderful. And then, we have translation programs, so we'll work it out if we need to.
you.
But that's going to be really exciting. So I guess my last question, you've got the book coming, you're doing amazing work in your community at 3 different locations. Are there any other goals in the immediate future for you?
Yes, this year I became a member of the Italian Society of Palliative Care. And I work with the team doctors engaged in integrative medicine to expand also the knowledge of oncology massage to them, and then to reach healthcare professionals, because we know that people, nurses or health professionals like operators knows more about aromatherapy, massage therapy. It could be very interesting for them to know more about oncology massage and palliative touch, because they can also doing that during their work and giving support to people at the end of life.
That's amazing. That's amazing. So just kind of, again, spreading the word and the work in a really positive way. And that's really exciting. I'm assuming the Italian Society of Palliative Care is mostly physicians and doctors. So bringing you into that environment must be really, really exciting. And I'm so glad that they are interested in what you bring to the table, which is just going to mean more acceptance and honestly more work for other people. So I hope you're also thinking about training some other folks in doing this kind of work.
I hope to.
Well, it was a real pleasure talking to you. Thank you so much for your time. It's just really wonderful to hear about the work that you're doing and all of the new and exciting things that are happening for you. So again, I'm going to say congratulations and thank you again.
Thank you too, Erika.
All right, collaborators, have a great day, and I hope you enjoyed today's podcast.
Thank you for listening to S4OM's Collaborative Connections podcast. If you found the information we shared today insightful and valuable, share this episode with a friend, or let us know you love this episode by tagging us on social media. Our goal is to bring the oncology massage community the latest research, education, and best practices possible. We love hearing from our listeners and welcome your thoughts and suggestions for future episodes. If you have any questions or feedback, you can email us at podcast@s4om.org. Until next time, thank you for listening.